So from the time of diagnosis, it is a really, really hard time for patients, and my heart really goes out to patients who have diagnosis, and especially those who find it difficult to cope simply because of lack of support within the community, within the family, or for other reasons. So we have, it's not just me, we have a team of clinical nurse specialists, speech and language therapists, nutritionists and dietitians who will help the patient through the cancer journey. So when I first see patients and break the diagnosis to them, my clinical nurse specialist colleagues will be there, and they will offer the patient, they and I will offer the patient lots of information about the treatment. So as a professional, I believe that the more information we give patients about the diagnosis, about the treatment, about the side effects they can experience, the recovery and the long-term outcomes, the more satisfied they are with the care and the more confident they can be with the eventual outcome they expect to achieve. So I work on a principle of information saturation. Different patients have different levels of saturation, but I give them information until they say, yes, all my questions have been answered. And that to me is a fundamental principle of counseling patients through. So we sit with patients as a team, not just once or twice, but several times until we know patients are fully aware of what the treatment involves for them. Once we do that, we will then offer patients within that envelope of information. We will offer them information about the treatment process, the complications, the risk they are undergoing, because surgical procedures, some of the ones we do, are fraught with significant complications. And if for whatever reason, a multitude of reasons, if the surgery doesn't go according to plan, then patients can expect a significant stay in hospital recovering from it. Thankfully, the risk of death with head and neck cancer surgery, even major surgery, is very low. We know from good data that the chance of dying from a major head and neck cancer surgical procedure is less than 1 in 10,000. Because we have honed our procedures, our pathway, our skill set to ensure good outcomes for patients. However, things can go wrong. When things go wrong, the subsequent treatment for patients get delayed, or they have complications, they spend more time recovering from the complications. So we apprise patients of all this activity around the surgical pathway and then put them through the process.